There's this study that's been on my mind lately about
Yeah?
how structured conversations between nurses and patients can actually prevent falls in hospitals.
Oh, that's interesting. How does a simple conversation make that big of a difference?
Well, it's more than just chit-chat. The nurses use a specially designed leaflet and communication guide to have these structured talks with patients,
hmm
focusing on their individual fall risks and how to prevent them.
So it's like personalized coaching for the patients?
Exactly. It empowers patients to be active participants in their own safety rather
Right.
than passive recipients of care.
That's pretty cool. But did the patients actually feel more involved after these conversations?
Yeah, they did. The study showed that patients reported higher levels of satisfaction and felt more engaged in preventing falls after the
Okay.
intervention.
But were there any measurable decreases in fall rates?
Interestingly, despite the positive feedback, the overall fall rates didn't decrease during the study period, which suggests there might
Really?
be other factors at play.
Like what?
Well, the nurses mentioned time constraints as a major barrier to
hmm
implementing the intervention consistently.
So even though the intervention is effective, it's hard to sustain in a busy hospital environment.
Exactly. It's like having a great recipe but not enough time to cook it properly, so the
Right.
outcome isn't as good as it could be.
That's a good analogy. But do you think with more support, nurses could integrate this into their routine?
I think so. The nurses themselves saw the value in it and even
Yeah.
expressed intentions to continue using the materials.
Maybe additional staff or adjusted workloads could help.
Definitely. Plus, involving other team members like physiotherapists or family members could distribute the responsibility and make it more
hmm
sustainable.
It's interesting how such a human-centric approach can have such an impact.
Absolutely. It reinforces the importance of patient-centered care, especially in
Yeah.
fall prevention strategies.
I wonder if this could be adapted for other risk areas like medication management.
That's a great point. Structured conversations could enhance patient engagement in various aspects of care, not
Right.
just fall prevention.
But circling back, why didn't the fall rates drop if patients felt more involved?
It's possible that the study duration was too short, or that other environmental factors overshadowed the intervention's impact, like the
Okay,
hospital layout or staff shortages.
that makes sense. So maybe longer studies or broader implementations are needed.
Exactly. And tweaking the intervention to fit seamlessly into the nurse's workflow could make a big difference
hmm
in long-term outcomes.
Did the study mention any patient characteristics that affected the results?
Most patients were older adults with neurological conditions like stroke or epilepsy, so their
Right.
fall risk was already high.
So perhaps additional support mechanisms are needed for such high-risk groups.
That's probable. Also, 4 patients did fall during the study,
Oh
but
no.
thankfully, they only had minor injuries.
Well, that's reassuring, but it highlights the complexity of fall prevention.
Exactly. It's not just about educating patients, but
Yeah,
also about addressing system-level factors.
like staffing, environment, and maybe even technology aids?
Absolutely. Maybe integrating reminders into electronic health records could help nurses manage their time better and
Right.
ensure the intervention is delivered consistently.
So what's the takeaway here? Patient involvement is key, but it needs organizational support to be effective.
You've nailed it. It's a team effort that requires commitment from both individuals and the institution to truly make
hmm
a difference.
Well, this has been enlightening. Maybe we should advocate for more such interventions.
I agree. It's like planting a seed that needs care
Yeah.
from the whole garden to grow.
Beautifully put. Here's to safer patient care and empowered patients.
Cheers to that.